Partner notices that she seems somewhere else and doesn't respond when spoken to, even during contractions. If touched unexpectedly, she startles. She's not making eye contact. Pushing stage, she is clearly detached, struggling to follow instructions, has difficulty feeling connected in what is happening. Um, she is,
No, it's
you
with this
know,
guy.
early
That's
into labor, she's feeling in control. She's able to manage the situations. This is what's happening. But as this stuff starts intensifying and the pain increases, her nervous system is interpreting as overwhelming and threatening, triggering this freeze or disassociation. We see it, classic sign of dissociation. She's disconnecting, she's mentally escaping. All of these things are happening. We see a startling response, which could be some hypervigilance there, detaching, disassociative state. We see disconnection from her body. These responses, she's feeling unsafe. Keep this in mind as I quickly talk about trauma-informed cares and the skills there. So, trauma-informed care, this model, and you have it in your handouts, this model here, in your handouts to keep with you. It's a framework. It creates safety, trust, and empowerment. It addresses all of these issues that I have laid out for people who have this sense of past trauma, for individuals who have experienced trauma. So, this is an explanation. Enter and attune. So, the concept here is that trauma survivors are highly sensitive to nonverbal cues, ambiguity. Their past experiences have taught them they need to scan for safety. Before you even speak, enter and attune. They're reading your body language. They're reading your tone. They're reading your presence. You need to be very self aware, lots of self awareness, and dealing with people with a history of PTSD. So even before you enter the room, pause. Take a moment, observe the room, assess the situation. Think about Carla or think about Tamika. How would you pause before you even speak? Start reading the body language. Start reading the tone of the room. Be present. Take a moment. Look for signs of hypervigilance, disassociation, all of these things. Things can get very chaotic. Ask yourself these questions. How are they coping? What support? What are people in the room? How are they interacting with what's going on? Are there any vulnerabilities or communication barriers? And in doing that, match the patient's tone, posture, intensity, get eye to eye. If they are quiet and calm, you can come into the room and lower your voice and approach gently. If they're panicked and intense, you can match that energy, strength and presence, without it escalating. You can say, ha, mirroring, I see you. This fosters connection. It reflects their emotional states back to them. And this can help trauma survivors feel understood, reflecting this empathy, verbalizing what you're seeing. I see Carla or Tamika. I see you're working really hard through these contractions.